Hi, my name is Sheri Carter. I'm an addictions counselor at the Northern Addiction Centre from Grand Prairie, Alberta. I'm an HSAA member. My roles in HSAA have been a member engager, I am a local unit chair, and I am a steward. And I'm also on the 50th anniversary party planning committee. So back in 2009, we were transitioned in from former ADAC, and we became Alberta Health Services. And as such, HSAA came to Grand Prairie and did a membership drive, and some staff and some board members came up and had an evening with us and kind of introduced HSAA, introduced themselves, and talked a little bit about the union. And I knew at that meeting that it felt like a family, and I really wanted to be involved in it, and right away became the local unit chair for the Northern Addiction Centre. I have felt that people have been very lonely in the pandemic, and having people to reach out to has been key for that. Part of that has been changing how we do things. So especially in addictions counseling, I want to see you face to face. And we can't do that in a pandemic. So we've really had to shift our focus to be able to do Zoom and to do telehealth and to do phone calls. But it is key that we still reach out to people in healthcare, to our clients and to the public, and make sure that people know we're still open, we're still here, we're still available to you. When we first transitioned in, as addictions counselors, we don't have a regulatory body, and that was a really big struggle for us. So HSAA actually helped us out with that when we first transitioned in. We started an ad hoc committee, and it actually turned into a part-time position for one of the other members who's also an addictions counselor. And it's been a process. We're still fighting the fight. We actually have a regulatory body that's all ready to go. Everything's all set up, and we are able to be registered if the government would sign it into proclamation. Most recently, the fight for public health care has been very dear to my heart. The population of people I work with don't have access to private health care. They don't have funds for private health care. And so they would be lacking in that area. It's really important for me to have safe consumption sites. It's really important for me to have harm reduction supplies, work from a harm reduction strategy in addiction services. And I all feel that that aligns itself really well with public health care. And so getting involved in the public health care fight has been very near and dear to my heart. The clients that I work with, their social determinants for health are already really low, and they don't need another barrier to access health care. I've seen HSAA change in a way that has become more political and more loud, and I really appreciate that we're out there, we're in the public's face, that we have these campaigns going, and that we're advocating for Albertans and not just for ourselves. So it's really not about how much money I make an hour, it's about protecting Albertans and their right to care. And I think that as Albertans and as a society is very important. And as a union, we have that role and a responsibility. It's important for us to stand up and say those things. When I first saw one of our HSAA commercials on TV many, many years ago, I shushed the entire family. I said, "These are my people, I want to hear this." And so listen to it. And now even today when an HSAA sign comes on or a commercial comes on, my kids are like, "Look, Mom, it's your people." And these are my people.